Depending on how old you are, you either remember when doctors made house calls or you've heard stories about it. For the last few years, a local doctor has been going to his patients. Spectrum News13's Eric Levy found out during the pandemic it means even more.
Mrs. Bennett thought her husband had had a heart attack and was afraid to let him climb the stairs to the bedroom. She'd kept him absolutely still, as Mrs. Wade advised, until the doctor came to examine him.
Well, that was the 1940s, when doctors making house calls was the norm. 80 or so years later, it's still a thing.
You know, I think it's the best kept secret in medicine myself.
That's Dr. Martin Schnell, and his office is his car.
Well, that's a bag I carry just some basic equipment in.
With his cell phone for social distancing reasons, he showed us around his mobile office, which is just about everything you'd find in an exam room.
You can see my stethoscope over there. And then this big black bin is just wound care supplies. And we think for a lot of conditions that afflict elderly people later in life, we can treat these conditions at about 10% of the cost of a hospital.
He's been hanging with me for a long time. I really appreciate it.
One of Dr. Schnell's patients is Jack Rhagar. He's been in a wheelchair for more than 50 years after a car crash, and his health puts him in danger of getting coronavirus. And Jack can get around inside his house and has a ramp to go outside and a van to drive should he need to leave.
So it's real important to me because like I say, I'm in high risk, and I don't like to go anywhere except for a doctor or a grocery store.
And if you ask Dr. Schnell, he might say his motto is,
I'm here to take care of patients, and if patients need to be seen and they can't get in, you have to take care of them.
Eric Levy, Spectrum News 13.